Brian Anderson, we just got confirmation of a 9th confirmed case of coronavirus in Lane County. Public health officials are holding a press conference right now.
And Chair of the Board of County Commissioners, Heather Buck. So with that, I will go ahead and introduce Mayor Lundberg from Springfield.
Please.
Good morning. Each and every day, we can take steps that benefit our community. We must, for the sake of everyone's health, comply with the stay-at-home order. However, we can still find ways to not feel isolated and to stay active. Getting outdoors and finding ways to exercise at home are great options when it comes to staying healthy while helping stop the spread of the coronavirus. We can still take walks, hike, bike, and run. Willamette Lane parks, trails, and open spaces remain open. Here are a few tips for social distancing outside. Practice proper personal hygiene prior to heading to the trails. Wash hands, carry hand sanitizer, do not use trails if you have symptoms, cover your mouth and nose when coughing or sneezing, etc. Observe social distancing of 6 feet from other people and warn other trail users of your presence and as you pass to allow proper distance. Leave no trash. Take everything out to protect park workers. We can also still make time for others. Call and check on your neighbors. Pick up food to go from your favorite restaurants and access a host of great resources from online library services. I've seen so many people and businesses adapting and working to support one another. We can be there for one another through this time. We just have to do it a bit differently. Thank you for making the health of our community a priority.
Good morning, and thank you, Jason, for sanitizing the lectern, and thank you, Mayor Lundberg. I'm Mayor Lucy Vinnis in Eugene. We are in day 5 of Governor Kate Brown's Stay Home, Save Lives directive. We are heartened to see the majority of Eugenians doing their best to follow this directive while navigating this period of incredible uncertainty. The city's efforts this week have continued to support the health and safety of every community member. We are focused on strategies to flatten the curve by reducing the need for people to travel around the community in search of necessities and shelter. We are partnering with multiple agencies, including Lane County and our local service providers, to directly support our community members experiencing homelessness. Outreach teams of city staff from multiple departments are providing supplies directly to people experiencing homelessness through direct canvassing efforts that meet people where they are. These outreach teams also provide information about COVID-19 and where to access help. There is more work to come in this effort, and we know our strategies will adapt as we continue to learn more and respond to this dynamic situation. The Eugene Police Department continues to work around the clock to protect community members. EPD, to gain compliance with the Stay Home, Stay Lives directive by educating people, EPD aims to gain compliance with the Stay Home, Save Lives directives by educating people who are not following the governor's orders. However, if someone believes their employer or a business they visited is not following the governor's order, they can call the county's COVID phone line or report the incident directly to Oregon's Occupational Safety and Health Administration, known as OSHA, through their website. We continue to ask community members to be informed and follow CDC guidelines on how best to protect themselves, their families, and their community. This is a critical time in our community's fight against COVID-19. Based on what we've seen in other cities and across the world, social distancing can make all the difference. It will give our healthcare system the precious and critical time it needs to meet the coming demand. So thank you, Eugene. Thank you for taking this seriously, and thank you for staying home and saving lives.
Thank you to Mayor Vennis and Mayor Lundberg for your leadership at this time. Our partnerships with our cities, both big and small, are more important now than ever. I would like to begin by thanking all the people who are making the very tough choice of staying home and limit their trips to the grocery stores and other essential businesses. I would like to thank the business owners who are putting the health of our community first and doing the very hard thing of either closing or making major changes to their operations. And my thanks on behalf of Lane County is also extended to the medical providers who are on the front lines providing care for our ill in our community, both for COVID-19 and other illnesses. The first responders are continuing to provide emergency services to community members in need and keep us all safe. Our partner agencies, both governmental and nonprofit and faith-based, who are working hard to find ways to continue to support our vulnerable community members. The volunteers who are continuing to find ways to support our community, including bringing supplies to our older neighbors and our loved ones. The grocery store employees, gas station attendees, truckers, and pharmacists who are working around the clock to restock shelves and to help ensure we still have the supplies we need. The folks who are ensuring our utilities, electrical, water, wastewater, and our other public transportation continue to function well. Our school employees who are feeding our children and creating online educational services and resources during this unprecedented cancellation of schools. Our local media who are working diligently to share information with our community. Our public health staff and emergency operations personnel who are focused on limiting the spread of COVID-19 amongst us all, including the unhoused. The people and companies who have been able to donate personal protective gear and equipment so that we can distribute those to medical and first responders agencies in need, including South Lane Fire and Rescue, Florence areas, and more. Please keep donations coming. We will need them as this continues. I know this list is not exhaustive, and if we failed to mention someone, please know that you too have our gratitude. We're also appreciative of those out of concern for us all are continuing to contact local authorities to share their concerns about the ability of local businesses to practice social distancing if they're still operating. As in Eugene and Springfield, our focus will be on education and helping businesses understand the importance of social distancing. The requirements of the governor's executive order are ones that we want to ensure that we give the proper educational information to. The state has created a method for residents to make reports as well, and that information is available on our website. In closing, I urge all of you to join me and my family in continuing to stay home and save lives. There is no cure for the coronavirus. There is no magic pill, but we do know one thing that works, and that's staying home. When you do that, you save countless lives in our community and beyond. Stay home, stay safe, and save lives. Thank you.
Let me start off by thanking our elected officials. I've been a part of multiple emergency events, and it is beyond important and encouraging that we have elected officials so committed towards one cause and having that unified voice that really is paying attention to the situation and acting accordingly. So it's much appreciated. I'd like to give you a testing update and a case count. So what we know about testing is that we have at least 415 tests that have gone from Lane County to our various labs. Again, it's important to point out that that number is likely quite a bit higher, probably in excess of 500, but that's hard to tell at this point. And we've explained this before, but really just going back to that there's no requirement for reporting out those negative tests. So we're getting those in various different forms and then trying to make that information as known as possible as quickly as possible. Right now we have 9 positive cases in Lane County. So if you remember yesterday we had 7, so there's 2 new ones. Let's go ahead and explore those. The first one is a male. This individual is in his late 60s. The initial onset of symptoms for this person was on March 18th, and they included a fever, a cough, and extreme fatigue. And that extreme fatigue piece does seem to be a commonality on those initial symptoms, if that's helpful for people to know. Then it graduated into chills and a headache, as well as vomiting. And that vomiting looked like it happened for about a week. And then shortness of breath ensued on March 25th, which led to this individual being tested on the 26th. He is currently hospitalized, but in stable condition, so that's good news. And this individual is from the Eugene-Springfield area. Our second case that we're going to announce today is a woman in her mid-50s. The initial symptom onset is still being determined, and part of the reason that we're still determining that is she has a couple different pre-existing medical conditions that mimic some of the conditions of COVID-19, and therefore it's being evaluated which ones are COVID-19 and which ones were due to her pre-existing conditions. She had potential contact with a known case, which is what led to her initial testing on March 17th. We received the results yesterday, and she does reside in the Eugene-Springfield area. It's important to note that both of these individuals live in private residences, and our second person, the woman in her mid-50s, is at home and in good condition as of this time. Another thing I'd like to point out about what we're seeing in terms of commonalities between cases is there seems to be a consistent loss of taste and sense of smell before the other symptoms really ramp up. And what we're really trying to do by sharing this information for you is help you understand what we're seeing here at a local level, because there is variability as we look across the nation. And I think a lot of the information that's being reported out at the national level is more statistical in nature. And we really want to give our community some of those actionable symptoms to look out for, with the acknowledgement, of course, that there seems to be a great variability between cases. And there are other things like allergies, flu, and other things going around right now that needs to be considered before you call your provider or before you get tested. Now I'd like to move on to addressing a couple of the questions that seem to be reoccurring that are coming into the Emergency Operations Center that we're hearing as the public information officers. One is about a question about the number of ventilators and hospital beds that are available in our community. and we are working on getting an answer on that. We have an idea, of course, with our tracking, but we have to work with our various agencies to get a full picture. As you're aware, ventilators are not just in a hospital setting, they're in a first responder setting, they're in various settings across the community. Anywhere a surgery is done typically has a ventilator, so we're really trying to get an accurate picture and a comprehensive picture and be able to share that with you so that our public can remain informed and then also really understand what we're working with and the importance of not flooding our medical system. Another thing that we've heard, and this is one that I think deserves some attention and a concerted response, is shouldn't we just go out and get COVID-19 to build immunity and get this over with? And so that is definitely problematic from a public health perspective, and we want to make sure that we can address that because that's something that we're hearing over and over. And the answer is absolutely not. That is not an effective strategy, and while some people might recover effectively, there is a huge variability on how individuals react to the virus, and what we would be doing at that point is really effectively transmitting the disease and escalating the situation, overrunning our hospital system, and really getting to a point of no return. So that is something that we want to really strongly message out there, that that's not an effective strategy, nor should it be considered. That what our elected officials have already reiterated, and we've been saying every day, the most effective strategy is to prevent transmission by staying home, practicing social distancing. What is the vaccination status of known cases? So that is a data point that we are looking at making available. However, as we are ramping up our data collection, it does take time, and we are compiling the data to be able to get a full picture. So expect that to be reported out at some point. The projected duration of the outbreak and the projected number of current cases. Can you talk a little bit about that? So with the projected duration of the outbreak, that is a very tricky question because typically you would base that projection on some quantifiable data that we simply do not have at this point. Some of the projections that have been shared through our medical provider call and some other settings are not really based at a level where we would feel confident at making any certifiable decisions on. So what we're looking at right now is sort of juxtaposing local data with state data, with national data, and coming up with some ballpark figures. We're still a ways out on that. Our health officer has said by the end of the month we should have a better idea, so we are working very hard to make some of those numbers available for folks and give you a better idea about what we're projecting. However, even when we do, it's really important for folks to know that those numbers will really be based on a very limited data set. Crowding at grocery stores. We've heard a lot of reports from people saying, you know, I went to the grocery store, it's very crowded, the lines are packed together, and social distancing is not happening. So we're aware of those situations, and we are actively setting up strategies to be able to communicate with our business community, point out some of those areas. You know, in light of enforcement happening, the other strategy is really the education piece. So helping them understand how to do that in their setting, and then following up to make sure that's happening. So that work is being done. However, I'd like to point out a few examples, at least one, where that is happening. So Jerry's in Springfield and Eugene, we've heard has some very effective strategies. They're looking at actually measuring the distance between people in the lines and making sure that stays at that 6-foot level, and also making sure that the interaction between the cashier and the person purchasing whatever they're buying has safe distance and that unnecessary contact is not being made. So while we are hearing those examples of that not happening, we are hearing examples of it actually effectively being done at the business level. So that's encouraging, and really what we're going to be working on is just trying to make sure that that is consistent across our community. Another point just to mention, starting next week, we will be moving to some more robust Spanish translation in order to make our press briefings and other materials more accessible to everyone in our community, and so be looking for that. Finally, I will go ahead and outline some of our priorities going forward from a public health response. So one of our first priorities is increased testing. We've mentioned this at past press briefings that has been a focal point, and there is some promising news coming from our community. There are some kinks to work out. That is actively being done, and hopefully we'll have some good news to announce to everyone in the near future. Community safety. So certainly looking at some of the issues like we just mentioned with the grocery stores, but then also working with law enforcement partners and other first responders to make sure that we are pursuing safety in the greatest capacity. Systems development, so making sure that our medical community understands, again, what to do when they see a case, when they get a call about a potential case, and some of the other components to making sure that our systems are adapted to this new reality of living with COVID-19. Protecting the least prepared and the most vulnerable amongst us. Certainly, I don't think it needs too much of an explanation as to why that's important, but it really boils down to saving lives. And we're certainly doing that and pursuing that with the unhoused community, but also with other populations such as our elder community, and that's something that needs to go forward throughout the duration of this situation. Planning for stability, so that's going back to the business piece and really trying to look at helping our businesses, fortifying them. That's happening at the municipal level, certainly with both cities, have been doing great work at reaching out to their business community and providing some solutions through the county loan fund and through some future planning on how to make that more accessible and at a greater capacity. But then also looking at really promoting some of those efforts, local business to adapt to this situation. And just recently I saw a Facebook group that is specifically designed around how you can help support businesses, how you can make orders. So that work's even being done at a community level, which we are very thankful for. And then our increased outreach to businesses, which I mentioned, and that is more in a formalized capacity where we can have those points of contact and help make recommendations known and then follow up on them. There's a lot of uncertainty and a lot of questions out there in regards to how can we effectively do this, remain open, and really helping our business community take a few of those things into consideration is going to be one of our priorities going forward. So at this time, I will take any questions from the media, and what we're going to probably do is I'll take the public health ones, and then if we have questions for our elected officials, I'll step down and let them take them.
So Jason, the first question is really a series regarding the communicable disease investigations, including how many investigators, what is that process, and are they being overwhelmed?
So the question is, what does your communicable disease investigation process look like? How many quote-unquote investigators are there? What does the process look like? What does it entail? And then are they being overwhelmed? So the first part of that, we have around 5 to 6 investigators, which is adequate for the time being. We do have a plan in place that if we need more, we have some experienced folks within the community who can step in, who have already made their volunteer status known. So we're thankful for that. Right now, we're able to handle that with that number. What the process really looks like is that our provider community, so our medical doctors primarily, have the ability to order those tests. When they order a test through a private lab or a public lab, the lab has a responsibility to notify public health when we have a positive. The provider is also notified so that they can make contact with the patient and notify them. Once that contact has been made, we get the contact information for the patient. Public health does, the communicable disease team. They make contact via phone, and we start gathering basic information. Things like, when did you start feeling ill? What did that entail? And we get that picture of what I share with you every day, which is that symptom onset. They also look at what kind of contact they made while those symptoms happen. So certainly we acknowledge that asymptomatic transmission happens. However, still the bulk of information really points to most transmission happens with symptomatic people. So what we're primarily looking at is what kind of contact did you have in the public and individually while you were symptomatic, and then really determining whether or not we need to have additional contact with those people. There's guidelines around that. So not everyone would meet that threshold of then having additional contact, or do we need to have a public message about a public contact point? And so just a hypothetical situation, if there was a small gathering, which shouldn't be happening anyways, where a public contact made, we would then try to reach out to each one of the individuals in that small gathering. If we couldn't reach out to those individuals, we would then do a public message. And the public message is really contingent on whether or not we can make contact with each individual. So hopefully that provides a little insight.
Alex Hassenstadt with KVAL would like to know if Lane County Public Health is discouraging the use of Advil and ibuprofen for COVID-19 symptoms.
So the question is from Alex at KVAL, and it is Lane County Public Health discouraging individuals from using ibuprofen or other products that have ibuprofen in it? So the answer to that is the data is really still out on that. However, there has been a recommendation from the World Health Organization. So we're taking it on a case-by-case basis. We're providing folks with the information that acetaminophen is an effective fever reducer and can be used in place of ibuprofen while we wait for that data to really come in. It's important for people to know that certain individuals in our community cannot risk going into a seizure or seizing. So sometimes certain medications can be used to prevent that. Ibuprofen can be one of those to try to reduce the fever and prevent seizing. So that's really some of our considerations, but we're not recommending that individuals use ibuprofen as an effective pain reliever or fever reducer in the meantime.
Have you seen any cases of COVID-19 in the homeless community?
So the question is, have we seen any cases of COVID-19 in the unhoused community? To our knowledge, we do not have any cases in Lane County within that community. However, we've really tried to make it clear that our understanding of what is happening in the community is really relegated to those most severe cases. So those individuals who are hospitalized, those individuals who have had contact with a known case, or if there is what we call an epidemiological link, meaning that they've had that real close contact and then we think that they were exposed to a point at which they need to be tested. So yes, we do know some information, but we don't have a full picture.
Second question from Rachel at KLCC. How are Lane County's other cities besides Eugene and Springfield doing in terms of social distancing? And are there any shelters being set up in other cities for homelessness?
So the question is from Rachel at KLCC, how are other cities throughout Lane County doing with social distancing, and are there plans for shelters to be set up in other areas? So the plans are ongoing in those communities, and really what we're looking at is what is the need, and then also really following up on the CDC guideline that if we are able to make those individuals or allow those individuals to stay in place where they're at and provide services to them, that's really the preferred first strategy. Certainly you're aware that when you put an individual into a congregate setting, we have to make sure that congregate setting follows all guidelines to ensure there isn't disease transmission. That has been a heavy lift, and so the process really includes looking at all those factors. So what we're really doubling down on is enabling individuals to have the services they need to stay in place. In terms of social distancing in those cities, we've heard good reports. We've also heard some bad reports, and we're following up on those. Really trying to encourage our other cities throughout Lane County to follow the same protocol. And then if you do see a complaint within your municipality or within your city, that you can use those resources to make complaints at the state level. So the OSHA form and other complaint mechanisms there. So what we've heard just so far, though, is predominantly positive, and that social distancing is really being considered, especially out at the coast with their unique situation. Last week with our tremendous weather, all the sunshine, we had those large crowds going to the coast. They've informed us that they've seen an improvement. That could be from the weather itself turned rainy, or just the fact that our folks are paying attention to those social distancing measures. And that's all I have for the public health questions.
If you are just joining us, Lane County Public Health just wrapped up their daily coronavirus press conference. KEZI 9 News reporter Michael Severin is standing by live outside the health department in downtown Eugene. We're back right after this.